This is United Medical ACO Weekly event, and my name is Kemal Erkan. I'm the chairman of United Medical ACO. Good afternoon. Today is July 16th, Friday. After 2 weeks break, we are back. This is United Medical ACO. My name is Kemal Erkan. I'm the chairman of the ACO. Today we have a special guest, Sarah Mcbride, our state senator. And we are going to talk to her about the FMLA. This is the latest from the state senate. And we have some other questions for her. And normally we have a lot of updates with the COVID vaccine and others. So I'm going to go through those very little. Let me actually just start my PowerPoint, and then we are going to come back to Sarah right after those COVID updates. So we are so happy to have you. And actually, I was just telling you earlier, so you and I, we never met. I'm assuming we never met, right?
I don't think we've met. We may have run into each other back in 2007 and 2008, but I don't think we formally met.
Were you involved with the Markel campaign then?
I was, both 2007, 2008 during the campaign. And then when he got elected, I also worked with him.
All right. So we'll talk all those. So thank you for joining us. All right. So let's see. Now, what we do, Sarah, in these events, we do give some updates on the COVID. We started last year. The idea is just to kind of keep in touch with the public, with our patients. Now, just to have some idea on the United Medical, there are almost 500,000 office visits every year. Our offices are seeing. It's about 115,000 patients. So today we'll do some of the vaccine updates, and then you are our main guest. So as you may already know, we do the medical billing, business development, care coordination, human resources, which is one of the reasons for us to invite you, IT support, accountable care, which is the value-based contracts with the healthcare, which is also you are involved. And we just got our approval with the Medicaid accountable care organization this year, and also the RCM-related services that we are providing. So from the vaccine standpoint, our goal is, we started with the test updates earlier in the beginning of the pandemic, and now we are giving the vaccine updates. I did a lot of videos with our providers to make sure that public is aware of the vaccines and then understanding that these are safe. So the goal of getting to the 75% from the Biden administration, we are trying our best to get to that level. Providing these updates does help everyone to understand that if we don't keep up with it, we may fall behind, and this does happen. And then I want to ask you later on your opinion on how we are doing with the vaccine, and if there's anything else can be done to speed up the process again, because the goal was by July we were going to be at a certain level, and kind of we are like pushing that out. And this is not something that administration can do, but I think the public response is kind of slowing down. And in Delaware, I think we picked up pretty quickly, and we are doing better, but we have the same pattern in terms of slowing down, and then that same thing happens here. So I'm hoping that we can increase those. From my network standpoint, with 160, 170 providers, with more than 100 primary care offices, we are able to do a lot more. And I had a meeting with Governor Carney, I believe about a month ago, just to kind of make sure that he's aware of our availability and what we are willing to do with the state. And I'm hoping that we can actually help his efforts, and then we can be part of his efforts. So that's these are kind of our vaccine Now, from the Delta variant, recently, actually, I was in Turkey for a short trip. I think everyone is, even outside of United States, other countries, they're all aware of what's happening. But I think the vaccine administration is extremely important to even deal with these variants. So unless we get to a certain level, it's going to be very difficult to get to the level that we want to be at. It was yesterday, I believe, the surgeon, general surgeon, so he was saying that most of the people who lost their lives are preventable by vaccination. So that's kind of sad from that point. So we really want to be ahead of the game. And if we are able to actually increase the vaccination, that would be the goal. So now, what I would like to do is, so I'm going to actually stop here for a second. So we are going to, well, if we have someone like you who's the superstar of Delaware, so we don't want to spend too much time on the vaccine and the other stuff, and we want to actually talk to you. And again, thank you for joining us. So the reason we wanted to talk to you first was, oh, can I do one more PR? So very quick. So because this is not for me, but this is for our animals. So we have an event coming up at on Thursday, actually, for Brandywine SPCA, Brandywine Valley SPCA. I'm on the advisory board, and this reception is for a fundraising for our little friends here. So it's going to be at the DuPont Country Club on Thursday next week. So hopefully there will be a lot of people, a good turnout. And if you are free, please join us. Okay, that's the last PR, so done. Okay, now it's all yours now. So now, when I was going through what you have done so far, again, one of the things that the reason we wanted to talk to you was the FMLA, paid FMLA. So now Susan Anderson is looking at me. She's right here with me. So, and then she's in charge of our operations, HR. She's our finance person as well. So every time there are changes are mandated by the government, we always look at it from the affordability standpoint. Mm-hmm. So I'm asking this question maybe on her behalf, and then we can talk about how what your plan is. Now I understand that this is just introduced in May, right? Mm-hmm. So and perhaps kind of giving us the background of it. I read a lot, so I mean, last night, probably more than 1.5 hours, I was watching several different videos and reading several different things related to your life and the videos that you have done. And so much there. So for people to really do what I did, they may not be able to do it. But if you can just summarize what that is for everyone so that they can understand why this is necessary and why this is so important. And what we are missing as a country that we don't have today and other countries do have.
Sure. Well, that first off, thank you so much for having me, and thank you for this public service that you're providing of these conversations and these COVID updates. I do just want to reiterate the points that you were making regarding the vaccines. I'm the chair of the Senate Health Committee, and so I am deeply committed to ensuring that Delaware reaches that herd immunity level of full vaccination, that the rest of our country achieves that the world achieves that, because we know we will all only be safe once worldwide we've reached that herd immunity. You mentioned the variants. We know that while the COVID vaccine is incredibly effective against the variants that we've seen thus far, the longer we go and without reaching herd immunity, the continued risk we face with variants that could develop that may not be as protected against by the vaccine. And so we have to get people vaccinated. It's critical. We are now above 70% of Delawareans 18 and older who've received at least one dose of the vaccine, but we have to get to that higher number of fully vaccinated Delawareans, fully vaccinated Americans, and fully vaccinated people around the world. And right now, one of the things that we do have to ensure is that we continue the public education campaign, that we continue to be creative around getting the vaccine to people where they are, breaking down any of those physical barriers to care that people face. I think, for some of us, it might seem small to take time off to go get a vaccine, but for someone who's working paycheck to paycheck, even taking that hour off to get the vaccine could be make or break for them to be able to pay their bills. So we have to continue to be creative about getting vaccines to people, breaking down those barriers, but of course, reinforcing for people that this is safe and effective and necessary for our own health and for the public's health. And that actually gets me into a lot of the motivation behind Senate Bill 1, which is the Healthy Delaware Families Act, which would provide up to 12 weeks of paid family and medical leave for Delawareans. Just to step back, I come to this legislation as someone who's been a caregiver in my life. My husband, Andrew, was diagnosed with cancer about a year into our relationship. And as two young people living together in Washington, D.C., we were each other's sources of support. And we were lucky to have employers who allowed both Andy and myself to take paid time off work for Andy to focus on the full-time job of getting potentially life-saving healthcare, and for me to focus on the full-time job of being there for him, supporting him, and caring for him. The treatment was incredibly significant and time-consuming, and for Andy, debilitating. He had to relearn how to talk, how to breathe, how to eat. After he had an incredibly invasive surgery, I had to be there to clean his tracheostomy tube, to tend to his wounds, to feed him through his feeding tube. Ultimately, Andy's cancer spread and it became terminal. But because, once again, we were lucky to have employers who provided us paid leave, we were able to take the time off for Andy to prepare for his passing, potentially get some life-enhancing palliative care, and for me to be there by his side. It also allowed us to get married before he passed away.
Now, he was a lawyer.
He was.
Right? So even for someone who is maybe in a, financially, he was probably doing better than most people. So this is not about just the financials at that point, because the care that he needs is at a really different level.
Well, absolutely. I will say he was an attorney. He wasn't practicing law. He was working at an advocacy nonprofit. And we were both living in Washington, D.C. at the time. So the savings that we had in the bank weren't as significant as potentially a practicing attorney might have. But we were lucky, right? We had that policy. And we also, in the extreme circumstance, had we not had that policy, we had family who could have supported us. But what I was about to say is so many people aren't that lucky. So many people are living paycheck to paycheck. And most people in our country and in our state do not have access to any kind of paid leave. Federal FMLA provides up to 12 weeks of unpaid leave for several different qualifying events. But it, again, is unpaid, and it only applies to individuals who work for employers with 50 or more employees within a certain vicinity. And so there are significant holes in an already insufficient safety net. Around the world, every other industrialized nation has figured out how to provide this critical support system for people when hard times hit. Because ultimately, everyone's going to face a major life event that's going to require them to take time off work, whether that's having a child and welcoming a child into the family, whether that's a serious health condition, or whether it's a loved one with a serious health condition that you have to care for. Every other industrialized nation provides this type of benefit except for the United States. Fortunately, though, a number of places have started to make progress, and now 9 states plus Washington, D.C. provide this type of benefit through a program very similar to what's in Senate Bill 1, the Healthy Delaware Families Act.
So now from the business standpoint, I'm a business owner, and going back to the question that Susan had earlier, now in terms of how we can make this affordable from the businesses so that it doesn't become a big burden for us, what's the, how can we make this both efficient or win-win for us? So what's the idea? Like, is it affordable? Is
yeah.
I was trying to kind of get into the details of it, but honestly, like just coming back from Turkey on Monday night, still trying to catch up. So if you can just tell us what businesses should be doing, what we should be expecting, because we do want to actually do more for our employees. Right. Just recently, in the last 2-3 years, we have made several different changes in our benefit packages. One of them was we made some adjustments based on our generational expectations. Like we have a lot of millennials, 65% at that time. We changed our eligibility for getting more vacation from 5 years, so we reduced it to 3 years to get more vacation. So instead of once you complete 5 years, you would get 1 week, right, Susan? So we reduced that to 3 years, so then they can actually see it, because you have younger people. They don't stay maybe for 5 years. So we try to give them certain things earlier. So we changed the short-term disability. We made it, I paid it for everyone. So because for the maternity leave, it became a problem. So then we said, well, if they're not getting the short-term disability, let's just make it standard for everyone. So I'm paying for everyone for the short-term disability. So if someone is pregnant, they can have maternity leave as long as they plan it accordingly. So right. How would this be operational from our side?
So that it's a great question. And that's one of the reasons why I'm so excited about this policy, is because I do believe it's a win-win-win. It's a win for workers, it's a win for public health, and it's a win for businesses and employers. Stepping back just for a second to sort of describe how the bill works, is it creates a statewide insurance pool that is operated by the Department of Labor. It would provide, through the Department of Labor's insurance program, wage replacement for workers while they're out on leave. So this isn't mandating that businesses just, for 12 weeks or however long the person's out up to that point, pay out their salary. The person would go off the salary of the employer and go on to the social safety net, the social insurance program operated by the state. That is funded by a very small fraction of a percentage payroll contribution split between employer and employee. That contribution is less than 1%, split between 2. So that means that an employer will pay less than 1/2 of 1%, and employee would pay less than 1/2 of 1% of their wages. So for a $15 worker, that comes out for an employer to roughly the cost of a cup of coffee per week. Now, stepping into the question that you asked around, is this affordable? Is this good for business? Yes and yes. So essentially right now, we know that paid family and medical leave is an increasingly not just necessary benefit, but desired benefit. And that's one of the reasons why you are seeing more and more larger employers providing this benefit on their own dime, because in order to win the competition for talent, they have to have competitive pay and competitive benefits. And so you're seeing large corporations that have significant profits providing this benefit on their own. The problem is, for medium and smaller size employers, it becomes difficult to provide this benefit on their own. And there are essentially 3 ways that this benefit could be offered. One is by an employer just saying, if you take off, we're going to continue to pay you. Another is through a private insurance program. And then the final is through a statewide insurance pool. Without question, the most economical and affordable way to provide this benefit is through the statewide insurance program. By pulling everyone together, we are able to have such a small contribution to fund the program that employers and employees don't really see that contribution impacting their bottom line. And then we're able to pay out the benefit. And in the states that have done this, in places like California, New Jersey, the data is clear that businesses say, over 90% of businesses say that their paid family and medical leave insurance programs either have no impact on their bottom line or actually have a positive impact on their bottom line. Because what ends up happening is, because this benefit is now available universally, they end up being able to retain talent that otherwise leaves their place of employment because they have a major life event, because they have a kid, because they have an illness, because they have to take care of a family member. And so in states that have passed this, they actually see lower turnover, longer loyalty to their place of employment, and therefore greater productivity because of the retention of that talent and that experience, and a reduction in costs for training and a reduction of costs in new hiring. Again, 90% of businesses, over 90%, say this has no impact on their bottom line or even a positive impact. And smaller businesses are even more likely than larger businesses to report that positive impact on their bottom line, because of that retention of talent, because of that retention of experience, and therefore productivity. Similarly, because a lot of businesses, I talked to a small business owner of Brouhaha here in Delaware. We all know and love Brouhaha. She's fantastic. And she provides some level of paid leave to her employees, but she's paying it out of pocket. She loves this because it's the right thing to do, but she also loves this proposal because if passed, her employees would see an even more robust benefit, and she would pay significantly less than she is for the less robust benefit out of pocket. And so she loves this because her employees are going to benefit, but she's also going to save money. And a lot of businesses are going to see that same kind of benefit because, again, this statewide insurance pool is a much cheaper option than paying it out of pocket, paying salary out of pocket. And the other positive is that when an employee is out on leave, now a lot of let's say an employee comes to you and says, let's say you're a small business without disability insurance. An employee comes to you and says, I have cancer, I need to get treatment. Well, businesses in many cases are like families, and that business owner is going to say, you know what? I know you still need to pay your rent. I'm going to let you take time off. I'm going to continue to pay you. It's not a formal policy. Now, those employers get to retain that wage. So when your employee goes out on leave, it's the Department of Insurance paying that salary. You get to retain that salary to save it, to, if absolutely necessary, pay overtime or even hire a temporary replacement worker. But businesses get significantly more flexibility with their money now because of this state-administered social insurance program.
So, do you see any concerns? Do you have any concerns with the government being a little bit more involved and getting a little bit maybe bigger, and there may be a little bit more headaches? And I'm just asking this because every time we have a little bit more government, we do have a little bit more problems, and we have seen this with Medicaid in some cases. Do you see this may become a problem?
So
like these questions, I mean, we have to discuss these because
absolutely,
it sounds great, and because we want to do these. Honestly, we spend a lot of time on the HR related issues because we want to retain talent. That's extremely important. We want to be flexible, so we want to understand our family structures. We can support the families because that's part of who we are. So we don't leave our families at the door. I mean, that's still part of us. So when we come to work, so if someone is dealing with, we use the example of cancer, but even it doesn't have to be that severe. But if someone has depression or someone has other issues, my company, we provide healthcare. Yeah. So while we are providing population health, for me to say it has to be so severe for the family member to get involved is not necessary, because we see how important it is for families to support each other. So, and I support the idea greatly. It's just like some of these, issues with the bigger government. What would happen with if there are any loopholes that may be creating some issues? Unless I don't know how much we study those. If you can maybe.
Yeah. So the beauty here is that we have already 9 states plus DC that that have these policies. So we're able to look at them and see that these policies run smoothly. These policies are positive. These are positive policies for workers and businesses. Does any situation, does any system work perfectly? Of course not. There's always going to be issues. You brought up Medicaid. Certainly there are imperfections in Medicaid, but the alternative of not having Medicaid would be even worse. You'd have significant portions.
In Delaware, we are actually, I'm sorry to interrupt, but Delaware we have a very successful Medicaid program. But in Pennsylvania, it's horrible. So Pennsylvania pays 1/7 of what Delaware pays for a physical, or a physician's office visit. So it's like one of the most horrendous, hideous program ever.
Yeah, and there's certainly variation state by state when it comes to Medicaid. But ultimately, the reality with Medicaid is no matter the imperfections in the system, having Medicaid, I think most people would agree having Medicaid is better than not having Medicaid. Not that there's not improvements that can be made. Here, generally speaking, broadly speaking, what we see is that this runs smoothly and it's a positive. Again, that doesn't mean that there aren't always areas of improvement in the systems that have been created, or for that matter, in the system that we will potentially create here in Delaware. But I was talking to an HR specialist who has clients in DC, Maryland, Delaware, Pennsylvania. DC has a paid family and medical leave program. The HR specialist was singing its praises. She said it's actually simplified things for businesses because it's actually also allowed for particularly small and medium-sized businesses that don't have in-house HR departments. It's not putting the burden on them to adjudicate and determine qualifications for this program. In many ways, this is able to outsource the HR costs to the state through the social insurance program, which the payroll contribution covers that administrative costs. And so therefore, it's actually taking off burden from HR departments or from business owners who don't have HR departments when it comes to the context of this leave. And so, there are already requirements around federal FMLA for larger employers. This actually would have less burden on businesses than federal FMLA in terms of the administrative process, since unlike FMLA, businesses wouldn't be forced to be the body that adjudicates and makes determinations on every single instance of a claim. And so the positive here really is that businesses will be freed up, whether it's the retention of salary, whether it's the freeing up of bandwidth for medium and large size employers, HR departments to focus on other things. So, this is really very much a positive for business in practically every way. And obviously there are going to be lessons learned. There's going to be areas of improvement as we go on. But I don't think anything that we're talking about here, any area of improvement in any of the states that have passed this, or, should we pass this, any of that is greater than the headache, one, facing businesses right now when they lose an employee, because that employee just has to end up leaving their job because they start a family, because they have an illness, because their family member has an illness.
One of the most expensive things for the employers is losing a trained employee.
Exactly.
Most expensive thing. It's extremely expensive. So
that's right. And we see 5 to 10% greater retention because of these types of policies.
Now, do you plan to make any changes on the eligibility requirements?
Yeah, so the bill has not moved. We introduced it in May, and I continue to engage in conversations with stakeholders throughout the community on the specifics of the legislation, including the Chamber of Commerce, including entities representing employers and businesses, to determine what the final piece of legislation that we push forward will look like.
So you have big support in the Senate, though, right? Like Valerie Longhurst is a big supporter of this.
Yeah, so we introduced this legislation in the Senate. I am the prime sponsor alongside our majority leader, Brian Townsend, and in the House, Representative Deb Heffernan is the prime sponsor alongside Representative Majority Leader Val Longhurst. And beyond that, we have more than 24 co-sponsors. In the Senate, we have 13 co-sponsors, which is a supermajority in that chamber. And so I do look forward to running and passing this bill next year. But in the 6 months leading up to that, we'll continue those conversations to ensure that the final product incorporates feedback and experience even more than it already does from all the different relevant stakeholders.
How about the governor? Is he supporting it?
I'm in proactive conversations with the governor's office and his team. We've been in discussion prior to introduction, and we'll continue to have discussions. He certainly recognizes the importance of paid leave for people, and I think wants to continue to engage in these conversations over the next few weeks and months.
So if it would be helpful, and if you would like to talk to our HR department
Sure.
to understand the mid-sized business issues, and if they may have some other questions, and if it's only going to help you, because I'm in full support of this, as long as we are able to understand and make it clear to our employees and our HR. So I think this is going to help for those who may need this. Now, again, this is going back to your personal experience, and I hope that no one has to go through what you went through. But you actually have some other personal experience that you went through in life, and if you don't mind me maybe going into that a little bit.
Sure.
Although I was just thinking about this a little bit. So, although you didn't want to actually be on the spotlight for this, right? So you are now part of the history. So it's almost unavoidable, right? So, what I was thinking. So now let's just make sure that everyone, okay, so everyone already knows this. So I may be a little bit behind with this, but you are the first state senator in the United States.
History who's transgender, correct?
Who's transgender. So now, not in Delaware, like this is in the entire United States. So that's a big deal, right? So, but when I was listening some of the videos, the time before you came out, and what you were worried about, like fitting in, being judged, and like not being accepted, versus now everyone is after you. So, like, you see the irony there, like.
Yeah.
Well,
I think it's
happening versus what's like. Everyone wants to have you now, right? As a friend, as a host, as a state senator, as a
yeah.
It's
frankly, it's incredibly it's incredibly empowering and moving to me that what once seemed impossible is now not just a possibility, but a reality. When I was growing up, the only references I had for people like me were punchlines in comedy or dead bodies in a drama. The idea that a trans person could run for office, let alone run and win, seemed so impossible. It was almost incomprehensible. And, I feared rejection in every sense of the word. I feared for my safety. I feared that I wouldn't be able to find love, live in a community I love, do work that I love. The fact that has turned out to be not the reality. Again, it's a reflection of progress. It's a reflection of how much hearts and minds have changed over the last 20 years. It's a reflection, I think, of the goodness of this community, that folks were able to look at me as a candidate based on my ideas and my experience, my values, not based on my identity. And I hope it's helpful to a lot of young LGBTQ people who can now see themselves more fully in government. Because the reality is, as lucky as I am, people are still facing discrimination and violence and rejection.
But I think what you were able to demonstrate, and at least what I understood from your experience, is what's the fear, that what we think what's happening is not the reality. That's the perception. That's what society is giving us, and then that's either we take that and live with it, or we create our own reality. And that's what you did. So you create your own reality, and then you become the history. And that's it's not easy, but it's doable. I mean, it's and I'm proud of you, and I'm very happy that you were able to do this, and you are a good example of this, because this can be done this way, and it doesn't have to be. And those stereotypes, I think we have to fight the stereotypes, and shouldn't be that way. I think people now are more aware of those, and I think we should be more responsible. We should take the ownership from every level. Sometimes this goes from as small as the family, from the smallest family level to the government level. If we are not able to weed out those problems from the system, we won't be able to see more Sarah Mcbrides. And again, I'm extremely happy for you. And the other thing is, and this whole the way that I was thinking, it's going on the other direction. So we were going to start with the Markel, and then so now Markel is at the end of the discussion. So now our other common friend is Jack Markel. So yeah. I didn't realize that you and I, we were there at the same time. So Jack now actually is the U.S. ambassador for the OECD. And when I saw that, I was extremely happy for him. So now, I don't know when you talked to him last time. So I was one of the early supporters of him. Actually, I got, I don't know if you remember, and then maybe John Carney doesn't want to hear this now, but we ran against John Carney that time with the primaries, and it was very slim race, and I think it was 1,700 total votes. And we supported him. He was a really good guy. And then I think John is really good now. And we supported him with the Congress as well. So now you actually, I didn't know that you had a more personal relationship with Jack. Can you talk about that a little bit?
Sure. I first met Jack Markel when I was volunteering for Matt Denn's campaign, actually, for insurance commissioner. And then I got to know him even more when I was working for Beau Biden's campaign in 2006. And we really just hit it off on the campaign trail. Jack, as you know, is just such a personable, kind, thoughtful person. But even more than that, he's an interested person. Every time you see him, he's always interested in you. And as a young person, I was 13, 14, 15, as a young person, getting to know at that point the state treasurer, who every time I would see him was interested in what I had to say, what I thought, what I believed, really was empowering for me as a young person. And so eventually I started working for him. You mentioned the 2008 primary. I actually was able to, they asked me to introduce Jack on the night he won the primary. So when I don't know if you're at the riverfront, but I actually introduced Jack Markel on the night he won the primary in 2008. It was one of the best nights of my life. I got really involved. And Jack and Carla really became—
You were on the 11th floor. That remember we were in that room upstairs. There was a—
No, so the not at the DoubleTree, the
this
on the riverfront on primary night in September.
Yeah, okay.
And on the night he won the primary. And he and Carla have really become like family to me. After he was elected, I became his body person. So I basically traveled with him everywhere. I was his traveling aide. And since then, he worked with me to pass non-discrimination protections for the LGBTQ community, marriage equality. And he really has just been like family. So I was thrilled when he was nominated by President Biden to be the ambassador to the OECD. I texted him and I said, "Congratulations, Your Excellency," which is the title that ambassadors get. And he said, "Well, I haven't been confirmed by the Senate yet." And I said, "Well, it's never too soon for me to start calling."
Last time I saw him was, it was before the pandemic. I was coming back from Boston, and apparently he was sitting right next to me on the plane. So, and I didn't realize that until we landed. Then I'm like, oh my God, this is Jack. So then we saw each other, and he didn't also see me either. So then I think he was talking to Carla, and then he's like, he's gonna take Uber. I'm like, my car is right there. So, and I gave him a ride to his house. So, and then we were able to catch up. So we go back all the way to 2004. And as you said, he was one of those people. When I met him first time, I didn't think that he was gonna remember me after that. And then 2 weeks later, I got a postcard from his office. and then something that was related to Turkey, something that happened in Turkey, and then he had some special, message. And since then, we were always connected. So he's a great guy. Now, do you have any special interest in the future? Like you're going to be in politics, right? So like I can probably tell you what's going to happen with you in the next 10 years. So you're going to be the congresswoman, maybe after Lisa becomes a senator, and then you are going to run for the governor, maybe, and then you are going to become the big senator. So now, do you have any interest in the foreign politics?
In what now?
In the foreign politics.
Well, I'm certainly just as a citizen, as someone who's interested in politics and policy, fascinated by foreign policy and international relations, comparative politics. I follow politics in a number of other countries pretty closely because I find it fascinating. My interest is to serve in the state Senate. I ran for state Senate. I mean, you saw before I ran, I was, an advocate nationally. And, if I wanted to do national work in federal advocacy and federal government, I could have continued on that path. But I saw that state government and state legislatures in particular are where the rubber meets the road on public policy. Mm-hmm. And so I decided to run for state Senate because I want to serve in the state Senate. I'm excited to be there. And I'm excited to work on so many different issues there, including so many issues around healthcare. But yeah, I do love foreign policy. I think all of us have a responsibility to know not just what's going on in our neck of the woods, but what's happening around the world. So
one of the things that I've been doing these days, one of my business partners and also one of my best friends, Dr. Isaiah Ergal, he's from Tigray, Ethiopia region. And we didn't talk about Chris Coons, but he's a really good friend and I'm a big supporter of him as well. And he's been helping with this situation. The situation in Tigray is pretty bad. It started in November. And I tried to kind of understand why, these things are happening around the world. And I talked to Lisa Blunt, Rochester, related to this issue after Chris Coons. And I think there's so much going on, but just wanted to mention this to you. I think someone like you probably would have more interest in these, as it's, I think you're going to be in politics for a long term. So you're going to be there. And then I just want to make sure that if we can catch up with these and kind of see if there's any way that we can help them in differently. I don't know what else can be done. And United States is taking a pretty active approach, and I'm hoping that we can. It seems like it's now a little bit under control, but never know when it's going to start. But this was great. So I'm so glad that I wish that I could remember what was happening in the 2008-2009 time period, because we used to have finance committee meetings with Jack every month. So I don't remember many people from those meetings, but definitely we should be able to catch up. So do you live in Delaware or do you live?
Yeah. I live over in West Wilmington, and my district stretches from essentially West Wilmington up through Bellefonte, up through Claymont to the Pennsylvania state line.
All right. So, and with this new bill, anything that you need from us, from the business employer level to the from the resident level, whatever you need from us, we'll be ready to help you.
Well, I appreciate that, and I think you mentioned it before, which is, throughout this process, drafting the legislation, and now, looking at moving it forward with potential changes. What I have always said is that this bill will be better due to conversations I have with all the different relevant stakeholders. And I've had already over 30 hours of conversations with employers and businesses and business groups. And I'll continue to have those conversations because I do believe that this policy is that win-win-win. And there really is a path forward here that is informed by all of the people that this policy will touch. So I look forward to continuing those conversations, and I certainly welcome your perspective on, the specifics line by line of that legislation.
Absolutely, we'll be here to help. Sarah, thank you so much. Thank you for your time, and we'll see you soon. Bye-bye.
Thank you so much for having me.